This is a short overview of Chapter 57, GI Secretion Drugs. Before we start, note that on page 998 in your textbook, Figure 57.1 shows the site of action of all of these drugs. The first class are H2 antagonists. These drugs typically end in the letters D-I-N-E, as you can notice by the bolded print of the endings of each of these words. Famotidine is the most potent of the H2 antagonists, and all of the drugs in this class prevent acid reflux in the esophagus and block the release of hydrochloric acid in response to the acid that is excreted when you swallow food and food appears in your stomach. They're used for short-term treatment of ulcers, prophylaxis of a stress-induced ulcer, for erosive gastric reflux or GERD, and to relieve heartburn symptoms. Ranitidine and famotidine also treat a pathological hypersecretory condition. They all cause GI effects, and with prolonged use, this class of drugs cause gynecomastia and impotence. Cimetidine is particularly prone to causing these last two side effects. You need to give the drug with or before meals, and famotidine is the only approved drug in this class for children ages 1 through 16. In the antacid category, sodium bicarbonate and calcium carbonate are the two that we've identified. They neutralize or reduce gastric acid by direct chemical reaction and are also used for sympathetic relief of upset stomach with hyperacidity. They can cause acid rebound, so if you've frequently given this drug and then when you stop giving the drug, the patient can feel the effects of having an increased amount of acid in the stomach. And because they are bicarbonate and have calcium and sodium, depending on the drug you're using, they also can cause acid-base and electrolyte imbalances. You need to give this drug apart from any other oral med either 1 hour before or 2 hours after a meal, because the drug delays the absorption of other drugs. You also need to take it with 2 to 4 ounces of water, and do not take it with milk because that will prevent absorption. Also, if it comes in a tablet, the patient needs to chew that tablet, not swallow it whole. The next class of drugs are the proton pump inhibitors, and if you will notice, they end in ZOLE, as I've bolded that. Omeprazole, pantoprazole, and esomeprazole are the 3 drugs listed in the class. They suppress gastric acid secretion. Note that for the patient taking an NSAID, taking a proton pump inhibitor or a PPI can help decrease the risk of GI irritation for that NSAID. They're used to relieve heartburn, treat GERD, and as maintenance therapy for a healing ulcer. They're used in combination for the eradication of H. pylori infection. In other words, you can use these drugs with an antibiotic to treat H. pylori infections, which is the cause of certain ulcers. Esomeprazole has the highest success rate for treating erosive GERD. Again, you're going to have some central nervous system and some GI adverse effects. Also, dermatologically, they can cause alopecia, rash, pruritus, and dry skin. They may increase the incidence of C. diff, diarrhea, and pneumonia in some patients. Orally, they are taken for a period of 4 to 8 weeks based on that patient's condition and their response. They are not established as effective and safe for children under 18. Note that this entire class of drugs can increase DIG levels, the levels of oral anticoagulants, and they can impact phenytoin levels. The drugs need to be administered before meals. They typically come in a capsule, and it cannot be crushed, chewed. It must be swallowed whole. This drug can also decrease the effects of clopidogrel, which is often used for clients who have had stents placed. So note those important facts. The GI protectant, the only one on the market, is sucralfate, and it is not systemically absorbed. It only works in the GI tract for short-term treatment of ulcers. It's been studied for treatment of NSAID-induced ulcers and for prevention of stress ulcers in acutely ill patients. The most common adverse effect of sucralfate is constipation, although it can cause the opposite, GI, diarrhea, dry mouth, those kinds of things. Constipation is the most frequent adverse effect. You should not use this drug in patients with renal failure or patients who are on dialysis because there is an aluminum base in this drug and it can cause the buildup of aluminum in the system. It is given on an empty stomach 1 hour before or 2 hours after meals and at bedtime. It's typically given 4 times a day. And the dose is typically 1 gram 4 times a day. The digestive enzyme pancreolase aids in the digestion and absorption of fats, proteins, and carbohydrates. It is used as a replacement therapy in patients with exocrine pancreatic secretion problems, and it helps them improve their nutritional status. And for patients who have steatorrhea, it can be used to normalize the stools of those patients. It is to be given immediately before or with food and snacks. If it comes in a capsule, it must be swallowed whole. However, it also comes in a form that can be sprinkled on food or taken without chewing. It is not systemically absorbed. It is absorbed in the digestive tract as that aid in digestion. The patient should be able to sit upright and to drink, increase their amount of fluids that they drink to enhance the swallowing of this drug. Antacids, as with other drugs, can decrease its effectiveness. Please review the nursing considerations for patients receiving these classes of drugs and also review box 57-4, drug therapy across the lifespan, which you will find on 998 underneath the nice picture of where these drugs work. Thank you.